what is your diabetic retina score? And what is a diabetic retina score? Well, we have new technology that can test for diabetes in the eye. I'm Dr. Troy White, and let me tell you about our new technology. This is called an ERG, and this will test how your retina responds electrically when we shine light in it. Very, very cool technology. So think of an EKG. An EKG reads the electrical responses from the heart, and it tells the cardiologist the health of your heart. This, we put little electrodes right here on the lower eyelid, and it's connected to this device. And then we hold this up to the eye. There's different lights that flicker, and then this instrument will read the ERG, the electrical retinogram. And so what it does is it tests the retina health, and it gives us an idea of how healthy your retinas are. Now, if you're diabetic, there's a test that we do for that. And what that does, it gives us a printout of what's called your DR, or diabetic retina score. And what we want is we want that number to be under 23. Now, what is that telling us? Well, when we shine light in the eye, the retina is going to respond electrically. The little electrodes that we have with this device is going to read that, and then it's going to print out. So two main things that we're looking at is we're looking at how quickly does the retina respond when light is shining in the eye, and then, in other words, is there a delay? We shine a light, does it take a millisecond, a half a millisecond for the retina to respond? And then what's the amplitude of that response? So we can see that in this printout here. So on this axis here is milliseconds, so delay. So if this patient had retinopathy in their eye and it was affected by the diabetes, this peak would be delayed, and we would see it come up further down on the timeline. Now, the other thing we look at is amplitude. So we shine a light, and how well does the retina respond? So if it was down low, it would tell us that the retina is not functioning like it should. Just like if it was delayed, it would show that the retina is not functioning like it should. So all diabetics, we run this test on all diabetics, and it really tells us how well the retina is functioning. The other thing it looks at is the pupil response. So we shine a light in the eye and we see how quickly the pupil responds. So if the pupil is real sluggish and is slow to react, that can indicate problems with diabetics. So again, come in to see us. All diabetics get this test run, and we get a diabetic score. What's nice about that is we can use that score to see how well you're maintaining your blood sugar, how well you're maintaining your diabetes. And then we have that score to test year after year and compare. Are you doing better next year than you were this year, or are you doing a little bit worse? And then what kind of lifestyle changes do you need to make to get that score better? We also use this instrument to test for glaucoma, and some patients fall under the category of a glaucoma suspect, meaning there's some signs of potential glaucoma, but we don't have enough evidence to say, yes, you do have glaucoma. This instrument will also look at the retina health as it relates to glaucoma testing. Sometimes this is the missing piece that we need to say, oh, you know what? You're fine. You don't have glaucoma because your retina is responding well when we shine the light in. It's responding quickly, and it's got a high amplitude. Therefore, you're much less likely to have glaucoma. So this is new technology we brought in at the beginning of the year. It helps us with glaucoma, it helps us with all of our diabetics, and there's actually a lot of other uses that we use to test and to monitor patients' retinal health. I'm Dr. Troy White. Nice talking to you.